This is Brent of the Brookbush Institute, and in this video we're going to go over manipulations or high velocity thrust techniques. I assume that if you're watching this video, you're watching it for educational purposes and that you are a licensed professional with high velocity thrust or manipulation techniques in your scope of practice. If you're not sure, check with your state board. Most physical therapists, chiropractors, and osteopaths, you're in the clear. I believe that ATCs, you can't do manipulations in the United States, although other countries. Again, check your scope. Of course, massage therapists and personal trainers, these are generally not within your scope. Of course, you could continue to watch these videos just for educational purposes, learn a little anatomy, learn a little biomechanics. If you're going to do these techniques, please make sure that you have a good rationale for putting your hands on a patient. This should be based on assessment, and if you're going to assess, I'm hoping that you'll assess, use these interventions, and reassess to ensure that you're getting the result that you're looking for and have good reason to continue using this technique. In this video, we're going to go over sacroiliac joint manipulation. The technique is commonly referred to as the Chicago technique or the Chicago roll. I'm going to have my friend Yvette come out. She's going to help me demonstrate. Now, this technique we could use for sacroiliac joint stiffness. Obviously, we want to base that on several assessments, not just palpation skills. However, if you want to look up how to do a passive accessory motion exam, which is basically a joint mobilization P to A, check out our sacroiliac joint mobilization posterior to anterior video, and you'll get a good idea of all of the palpation and how to actually place your hands and use that technique. Now, the technique itself is one of those that is going to look really easy when I do it and then not feel so easy when you do it. So be prepared. It is one of those deceptively hard techniques. But essentially what we're going to do is we're going to set our patient up in supine with the involved side, the stiff side, opposite us. So the way Yvette is set up now, we have to assume that I am working on her left SI joint. Now I kind of want to lock up that SI joint the best I can, and the way I'm going to do that is I'm going to place this leg over the top of this leg. All right, so maybe we get a little bit of posterior tilting there, and then I'm going to go ahead and kind of side bend that way. Right, this is sometimes referred to as smile away position. Right, so you're making like a little smiley face. So she's all locked up down there. Now we have to rotate her torso to lock up all of the segments above, right, which would be all of her lumbar spine. So as you can imagine, in a way, this is going to kind of have some similarities to that lumbar manipulation you guys saw in a previous video. Now what I'm going to have Yvette do is she's going to go ahead and interlock her fingers behind her head. I'm going to use this hand over the top of her ASIS to brace her pelvis. Now be careful, guys. Just because you put the palm of your hand over their ASIS doesn't mean that that can't feel very bony and very pokey to them. So adjust your hand so that you get nice wide purchase, a lot of surface area, right? But you're nice and stable. So we don't want any pinch there. I'm then going to try to lace my hand through her arm. Now, again, I'm a lot bigger than Yvette is, so I'm not going to be able to get all of my arm through her arm, but I can get the back of my hand onto her sternum. And that's probably enough. I can feel her chin on my hand, but I think that's okay. Now, what we're going to do is keep this down and rotate as far as we can into rotation, trying to make sure that Yvette keeps her hands nice and locked up. And when I start feeling a good amount of force pressing in to my right hand here, right, I lock out and thrust. And that's it. Again, that's not particularly complicated, but it does take a little bit of practice. Let me kind of go through one more time and then give you guys a couple little pointers to try to get that feeling of a lock and to get all the force right here so that when you do that manipulation, you actually get a successful movement of the SI joint. Right. So we said this leg goes over this leg. This gets side bent away. Now you could experiment with a little side bending of the upper torso. Right, so we get as much side bending as you can. And then, again, we'll put the hands back here. If you don't like this, you could do this. All we need is rotation of the spine. So if I rotate this way and maybe even like plant my fist into the table, and then I can kind of straighten out my arm. Right now, actually, I feel a lot better in this position, especially me being unable to get my hand in between her arms here because her biceps are actually so huge that I can't get them in between her forearms. She works out a lot. But that being said, I get her rotated up. All right, so I got flexion, rotation. I got her locked out this way. All right, and actually I lost it moving her around so much. All right, and this happens, guys. Like, this is part of the practice, right? So let's try again. We learned a couple things that time. So this leg over this leg, smile away. We side bench you this way, and when we first did that, that actually helped, right? We locked you up really fast. Now, we also learned, and this last time for me personally, that I don't like the arm through. Now, if you're a smaller person, you might be able to get your arm all the way through and hook your other arm on the other end of the table. I've seen that, right? And then that kind of ends up looking, can you just hook your arm around this arm? Right? Like, so that ends up looking something like this, but with her hands all the way hooked back. I've seen that. If she was doing this to me, that's what I would recommend. But for me, on the other hand, you can put your hands behind your head and be comfortable, but we've kind of found that I get you all set up into side bend, pull this way, use her forearms a little bit to get me started, but then place my fist here, right, rotate up by straightening my arm out. Now that I have her all locked up, make sure I get that force coming through this right hand. Like, I feel this coming up like this, and now I can end thrust. How'd that feel? Better than the first time?
Yeah.
All right. Big things to remember. Leg far away goes up, and you're going to side bend somehow. I've seen this done where people just side bend from the bottom. I've seen it done where people side bend from both sides. I think you guys need to experiment and try to figure out how you're going to get locked position. You can go just hand through. If you're a smaller person on a larger person, you can go full arm through and hook through the table, or you can start this way and then go behind and use your whole forearm against their back to try to pull in as much rotation as you possibly can. Right now, if you do that, keep in mind that you might have to continue to adjust so that you don't lose all of your lateral flexion in the process. Your goal is to get lock through here so that you start feeling pressure into this hand, so that when you go down to press, you're pressing the innominate through a sacrum that's trying to rotate in the opposite direction. Boom. Right? Practice. A lot of practice. Take some time to set this up with your clients. Remember, it's not a race. Take as much time as you need. If you guys have any questions about this technique, please leave them at the bottom. A couple of points to recap. Knowing your anatomy and knowing your biomechanics will certainly help you choose the right technique for the right patient. If you're unsure whether manipulations are appropriate due to their higher intensity, it's okay to do mobilizations. Most research points to manipulations being slightly more effective, but mobilizations being very effective. And of course, we have those videos for you if you want to start with those less intense techniques. Make sure that if you are doing any technique, that is based on assessment, and of course that you're reassessing, ensuring that the technique is effective for the patient that you're working on. And when it comes to all manual techniques, guys, manipulations, maybe more than any other, look for opportunities to get live education. Although I know videos are convenient and I'm happy to have these up for you guys to watch, it would be so much more helpful to use those videos as a recap of one-on-one attention with somebody who's experienced with manipulation techniques. At the very least, grab a colleague grab a friend, and start practicing these before you bring them into clinic and start using them on patients and clients. I hope you enjoyed this video. If you have any questions, please leave them in the comments box below.